Most men who ask me about Himplant fall into one of two groups. The ones it's perfect for, and the ones it was never going to help. And here's the problem. From the outside, they look exactly the same. So before you spend a single dollar or book a single consult, here are the 5 things that actually decide whether Himplant is right for you. I'm Dr. David Robbins, a board-certified urologist here in Miami. I trained under Dr. James Ellis, the inventor of the Himplant. One ground rule for this video. I'm gonna be straight with you. The Himplant is a real FDA-cleared device that's helped a lot of men to feel more confident. But it's not magic, and it's not for everyone. Let's get into who it's actually for. Number 1, and this is the big one. The Himplant is a cosmetic enhancement. It's designed for long-term flaccid length and girth enlargement. What it does not do is treat erectile dysfunction. If your real concern is getting or keeping an erection, then the Himplant is the wrong device. That's a different implant and a different conversation. Now, plenty of men have both goals, and we can map that out together. But we have to be clear on what you're actually trying to solve. If your answer is, I want to be bigger and feel more confident, then you're in the right place. If it's, I want my erections to work, then we have to talk about that first. Number 2, you're healthy enough for a short outpatient procedure. Good news, this is not major surgery. Placement takes roughly 45 to 90 minutes and you go home the very same day. But it's still surgery, so we check the basics. You have to have well-controlled blood pressure and blood sugar, no active infection, healthy tissue. If you do, they're generally a good candidate for this procedure. If there are any medical issues, then we like to handle those first because safety beats speed every time. Some direct contraindications of the Himplant procedure would be not having a circumcision. You have to have a circumcision to have the Himplant procedure. Also, if you have had permanent filler placement, then that would be a contraindication. Hyaluronic acid is generally okay. Number 3, and this is where I lose a few people, but I'd rather lose you here than in the recovery room. Realistic expectations. The Himplant gives you meaningful, long-term results. The men who are happiest a year out come in wanting improvement, not perfection. If you've got a clear, grounded picture of what better looks like, then you're a great candidate. If you're chasing a fantasy, the most caring thing I can do is tell you the truth. Number 4, you're doing this for you. The best outcomes I see are in men who have quietly thought about this for a long time and decided that they want to feel more comfortable in their own skin. That's a completely valid reason, nothing to be ashamed of. What I watch for is the opposite. Doing this to save a relationship, or to chase someone else's standard, or because of a comment that stuck. Part of my job in the consultation is to make sure that your head's in the right place, because the confidence has to start before the procedure, not after it. And number 5, you're ready to follow the recovery. This is the part that people skip past, and the part that protects your results. There's a healing period, a period where you'll pause sexual activity and follow the aftercare exactly. Do it right, and the device carries a limited lifetime warranty. The men who follow the plan tend to be thrilled. The ones who rush it create problems that were completely avoidable. Give it a few weeks of patience, and you'll thank yourself. So 5 things. This is enhancement, not an ED fix. You're healthy enough, your expectations are grounded, you're doing it for yourself, and you'll respect the recovery. But here's the honest truth. A YouTube video can't tell you you're a candidate. A real evaluation can. And a good surgeon will sometimes tell you no. I do. Because the goal was never to do the procedure, it's to do the right thing for you. If you checked most of the boxes and you want a straight, private conversation, no pressure, the link's in the description. I'm Dr. David Robbins. Take care of yourself.